From mask shortages to hospital preparedness, many of the COVID-19 questions we've had for nurses, we got answers to today. KXAN investigator Erin Cargile spoke with the director of practice for the Texas Nurses Association, Serena Bumpus.
We are continuing to get emails from different healthcare workers saying, my clinic is still not providing that personal protective gear for its staff. Are you hearing of a shortage? Is there enough to go around in Austin, in Texas? What should nurses do if they're not being provided that?
We do know there is a shortage, especially in areas that don't normally use protective equipment, such as clinics, long-term care facilities, home health. Our hospitals, for the most part, do have enough right now. I think that if we see the influx of patients that the other states have seen, our hospitals will also start to run out of personal protective equipment as well. The areas who don't normally use that, I'm hearing that they're waiting 6 to 10 weeks for their shipments to come in.
Wow. What should they do in the meantime?
In the meantime, as what they do have access to, the CDC guidelines do recommend that they reuse some of this personal protective equipment. And while that's not the ideal situation, if we don't conserve that equipment, then we're placed in a situation where we can't provide care because we don't have the equipment to use.
When it comes to masks, so we have been reporting on groups, companies, individuals in their home with their personal sewing machine making masks. While this sounds wonderful, are these masks actually usable and offering these healthcare workers the right protection?
There is no evidence to show that these masks are effective. And I know that the public wants to help in any way they can. There are large numbers of people in Facebook groups sewing masks and delivering them, and many facilities have actually turned them away and said that we can't use them. What I think we could use from the public now more than ever is to consider other creative alternatives to provide the equipment that we actually do need. So, for example, our schools are closed, and it's quite possible they might be closed for the rest of the year. We know chemistry labs have some degree of personal protective equipment in them, such as safety goggles and things like that. Can our public schools donate those to our hospitals? We know that there are other industries out there who use personal protective equipment that may be closed for right now. What can they donate to our facilities?
Travis County announced yesterday, while the numbers could be a little bit different today, that only 3 COVID-19 patients in the county are currently hospitalized. So many of us hear that and think, oh, the hospitals must not be very busy. Is that providing a true picture?
I do think those numbers are reflective of what our hospitals are experiencing right now. It can change at a moment's notice, though. I talked to colleagues across the country who work in the state of Michigan and Louisiana who just 2 weeks ago were operating business as usual, just like we are to some degree now. And within the last week and a half, they have seen an increase in a huge surge in COVID-19 patients inside their facilities. And now they are starting to wear down the use of their personal protective equipment and seeing a need and an increase for that.
That leads me to my next question. My best friend is a nurse in a Dallas hospital. We spoke just a few days ago. She said things are slow right now, but the message we're being told is, brace yourselves. A surge could be coming. Is that still what healthcare professionals in Central Texas are thinking right now?
Absolutely, they are. And as a city and in our surrounding areas, if we don't take the shelter in place seriously, it will only be a matter of time. We have to take the preventative measures and think of each other and our first responders and our healthcare workers and do the things that we need to do to protect everyone.
Bumpus also says many nurses are taking their own preventative measures to keep their families and their homes safe. And that includes changing their shoes before they leave and get in their cars, and even creating quarantine rooms in their home for anyone who tests positive for COVID-19. She adds many healthcare facilities outside of hospitals are moving to virtual office visits when they can, not only for health and safety, but it also helps with shortages we are seeing for personal protective equipment.